Welcome back to Beyond the Classroom. Might look a little different today. Today we are on LCCC's Laramie campus, but we're still talking about outreach and workforce development. Today with me I have Jamie McKim. Jamie McKim is the manager for outreach and workforce development over here on the Laramie campus.
Correct. You summed it up very, very quickly and very accurately there, James.
And so we're going to talk today about medical programs over here.
Yeah.
Jamie, can you talk to us a little bit? Tell us what medical programs you offer here at the Laramie campus.
Well, we're very new to the game, James, but we offered, for the first time about 2 years ago, we offered phlebotomy for non-credit programming. We are getting ready to stand up CCMA, which is Certified Clinical Medical Assisting. And we'll also offer in the spring of 26, we are partnering with our credit side to offer CNA, Certified Nursing Assistant, for our students.
So in a lot of cases, these are very short-term programs, right?
Correct.
So why is being able to fast-track programs like this so important to our students?
It's critical in this day and age with our workforce to allow people who may not have a ton of time to receive training, to get training that's needed to get them into the workforce and get them making an effective wage right away. Whereas you might see some students want to be a nurse, they've dedicated 4 years to it to get a bachelor's of nursing, where they can get training to do CCMA in 21 weeks and allow them to actually enter the workforce at a hospital. After a short period of time, they can actually be making a living wage, which is beneficial to some who don't really want to pursue an actual degree. They just want to get the training.
So you mentioned CCMA.
Sure.
What kind of skills do students learn in this program, and then what kind of careers?
Sure. Well, CCMA is very direct. Once a student receives the training, they'll be able to go to a hospital such as Ivinson, some of our partners that are local here in Laramie, and actually work as a certified clinical medical assistant. It's a detailed training program that is going to teach them the ins and outs of rooming patients when they come in, greeting them at the front desk, making sure that they have their vitals taken, and in some cases they may even administer like a vaccine if needed, or So it delves into a lot of different areas. It's very thorough, though. Like currently, we offer phlebotomy. Phlebotomy is actually embedded into CCMA, so they will actually learn the skill to become a phlebotomist.
Now, do you offer phlebotomy still as a separate course?
We're going to, yes. We will do CCMA here in the fall, and in the spring we're going to offer phlebotomy. We have some students that come to us through grant funding, and that don't want to go through all the CCMA training. We can do phlebotomy quicker. It's a program that we could start and finish in a couple of months, as opposed to like CCMA, which is a 21-week course.
So what all do they learn in phlebotomy?
That's a great question. In phlebotomy, everybody just thinks it's just blood. Like they're just going to go, I'm going to learn how to get, there's a lot more than that. They're going to learn A&P, anatomy and physiology. They're going to learn medical terminology. They're also going to learn the technique of becoming a phlebotomist. I think anybody can stick somebody in the arm, but the technique is to make sure that you can stick somebody in the arm where they're not hurt and they feel comforted. I think a lot of people really suffer from needle phobias, and that's part of the technique of becoming a phlebotomist, is learning how to deal with a patient who may not, nobody wants to give blood, but to actually be able to draw the blood in a way that is, not hurting the patient. So yeah, I think there's a lot more to it than just, I could just get stuck in the arm.
So we talked about CCMA.
Yeah. We've
talked about phlebotomy.
Sure.
About certified nursing assistant.
That's a good one. So I've been on this campus for 10 years. I've been with LCCC. We used to offer CNA here. It was a course that we taught at the high school. It was one that gives students, even in high school, that knowledge where they can go in and work in a nursing home or a hospital. But it's very hard to find an instructor. We had lost ours. And really, it's something that we had wanted to offer as part of the nursing program here at LCCC. It's now a requirement to get into the program that you have a CNA or you get a CNA. So we are partnering with our credit side to offer the class together. So we have an instructor, we have a training site, and we will be allowed to have a certain number of students go through it to receive the training that they can go and actually get a job at a nursing home or a hospital as a CNA. Those aren't as detailed positions. There's no phlebotomy involved. There's no, it's really just helping patients roll over, assisting them if they need something, and just that type of work. But it's a little bit different, but it can lead to, if they have interest in CCMA, they could go on to that. Typically, they go on, if they're interested and they're a CNA, they may go on to become a nurse and receive like a bachelor's in nursing. So
That's
nice
that they've got career paths.
Yeah, and that's certainly what we're geared for here at LCCC is we're a pathways school, right? So we want to show any student who walks in the door that we can show them the exact path to get to what they want, and show even typically what that position will earn when they're finished, so that they can, as a student, make a decision. I think so many of us on the credit side or the non-credit side, it doesn't really matter, go into college thinking, I'm going to do one thing, right? I think we all start out, I wanted to be a lawyer. That dream quickly left the wayside when I found out exactly what I had to do to become one. But this allows them to see, this is my path, and this is what I need to follow to become a nurse. Or, someone might want to take it further and become an anesthesiologist, or, a nurse practitioner. There's so many options, but it really starts with these basic trainings, these CNAs, these CCMAs, that allow them to get a foothold into the medical community, get them some of the training that are required, or at least see what it's like. If you don't like blood, it's probably not going to be for you, right? If you pass out. But, honestly, these are the type of positions, when you get into them, allow you to see, okay, this is something I absolutely can do. I could be a doctor. I can't be one myself. But, that's what is quickly learned, I think, in these positions, especially in phlebotomy. I had a student in one of our very first cohorts come up to me and tell me, I don't think this is something I can do. I panic when I see the sight of blood. I said, well,
that would be a problem.
Right? So I told her, I said, listen, we're going to give you a very capable instructor who's very passionate about phlebotomy and is going to train you in ways that you can learn to deal with it and have it become part of your normal day. She's employed as a phlebotomist now. She passed the training. It's just these little examples, these little wins that we have that we can pass on to other students that may struggle or be scared. Especially in these trainings that we have, like phlebotomy, they're going to be in the workforce within a couple of months. It's not like they have 2 years of getting an associate's degree before they can actually enter the workforce. They're going to go and get that training. So they need to be ready. And that's what we offer here, is we have a very capable instructor. She's amazing. She's been a phlebotomist. She's done all of our trainings, and all of our students have passed. She has a 100% test pass rate. Wow. But she gives them the skills that they can go, and confidence. Sometimes it's just a little bit of confidence, somebody believing in you, where maybe you didn't have that before. But yeah, it was great. And like I said, so proud of these little wins that we get that make you want to do CCMAs or go into CNA, or just offer, anything that we have in our cabinet that we can pull and offer as a training. So
it's awesome. Well, you've obviously been growing the program, adding different programs as you go. How does that align? What are the needs for healthcare here in Albany County?
So that's a great question. One of the things that led us to do CCMA was the fact that we have been doing so well with phlebotomy, but there's not as much of a need. There's not a need for 20 phlebotomists here in Laramie a year. So we really need to shift focus and say, what can we offer to our students that's in the community that's more employable and they're going to hire more of, and that was CCMA. That's really what kind of birthed it here, was the idea that we need to offer something that's going to keep our students competitive in the marketplace, give them the best shot at getting these jobs. And really, it's what allowed us to secure a pre-hire grant to pay for quite a few of them to actually get the training. And it's a renewable grant. It's something that we can keep doing. Really, it gets us invested in the students, because we would need to make sure that they are, after graduation from the program, that they're interviewing and they're actually working in Wyoming in the field that they've received the training in. So yeah, very cool.
So healthcare in general is pretty intense, right? The training for it's intense. I remember years ago there was a movie called Gross Anatomy.
Yeah.
And you could imagine, Matthew Modine and Daphne going through that, and you could see the stress on all of their partners. What kind of resources do we offer to these students to help them get through this?
That's a great question. First and foremost, we have an amazing instructor. She's going to work very closely with those students during the classroom work to make sure that they have the skill level that they need before they even enter the externship that they're going to have with our local partners, actually working in hospitals, working in clinical settings where they're going to work with the students before they even take the test. So they know that they have that teacher support. They know that teacher is going to go to bat for them. And another thing that we have that benefits the students is these classes are offered at times where if you work a full-time job, you can still get the training. So we do it Tuesdays and Thursdays from 5:30 to 9 and every other Saturday from 9 to 1. So if you have a family, if you have other responsibilities, whether that's work, whatever, it's something that can fit into your lifestyle that allows you to receive this training that you can still go and get a job. Now, they'll do an externship their last 4 weeks, and basically what that means is they're going to go work for our partners here in Laramie, in a hospital, in a clinic, helping administer care to patients who come in, get them put into rooms, take vitals, all that fun stuff that every one of us gets when we go to the doctor for our yearlies, right? So they're going to go in, they're going to get that training, they're going to get that confidence that they need, that support. They'll still have it from the instructor. The instructor won't work with them during the externship, but the instructor will still be there. And then once they get that externship finished up, they'll come back and they'll take their test, and they will pass. And then once that they receive their then notice that they've passed, they can enter the workforce and go work for a hospital or work for a clinic as a CCMA.
It's fantastic,
right? Yeah, it's a game changer. It totally is. Oh yeah.
So you shared one success story, the lady who, had a fear of blood and wound up being a phlebotomist in the end.
Absolutely.
Do you have another favorite success story?
My absolute favorite success story is one that partners with our adult education program here on campus, which will be a podcast for another time. But we had a student go through that, and it's the HISET, or the high school equivalency exam. It was a person who she was a dislocated worker. They had closed down her business that she worked as a manager at for several years. She didn't know what she was going to do, but she knew that she wanted to show to her children that she could get a high school equivalency. So she put herself through that training. We were able to actually get her a grant to put her through phlebotomy in the same year. So she receives the training in the spring for her HISET. She receives the phlebotomy training in the fall, goes through graduation, passes that, and becomes a phlebotomist. So, right now, you look at that was a complete game changer for a woman who had worked in a completely different industry. Now, she's been a dislocated worker where her business is closed down. What can I do to support my family? That really speaks to what we do here at LCCC. Our mission statement of our college is transforming students' lives through the power of inspired learning. I don't think that there's a better example than that woman who graduated from the HISET program, then did the phlebotomy, got that training, got a job as a phlebotomist. It changed her life. We physically transformed her life in 1 year.
Less than 1 year.
Yeah. So,
if it's just a matter of those 2 semesters, less than a year, right?
Yeah, correct. Yeah, absolutely. And we can do it for, I'm always of the mindset, if you do the work, you can do anything. And that's what she did. She just put her head down and said, I'm going to make sure I want to accomplish this goal. I want to accomplish a second goal and then get a job.
And because you had grants involved, there was very little out of pocket for her.
Absolutely. I don't think she paid a dime. And then she gets to go work a job that she loves and supports her family, pays her bills. So much of what we do anymore is just like, I use the joke, it's like everybody's got a mortgage, but it really is that. It's like we all have bills to pay. We all have, that's why we all attend our jobs. That's why we all do what we do every day. But if you can find something that you have passion for, maybe you didn't know you had a passion for, and then get to go do that every day. I mean, that's the game changer, and that's the winner, and that's really what drives the bus for us in adult ed over here. Is just like we can make a difference, and we can make a difference quickly.
When you love what you do, it's a lot less like work.
Right. You never work a day in your life.
There you go. You don't mind getting out of bed in the morning and going in there.
Right. And I can honestly tell you that this is a job that I've had for 10 years. I've never once thought, oh my gosh, I got to go to work today and this is X, Y, or Z is going to get in the way. It's like, what do I get to do today that's going to make a difference in a student's life? So
I've had way too many people over the years who, what I used to tell them is when you wake up 51% of the time, do I really have to go to that place?
Right.
It's time to find something else. Right. At 49, okay, you're still good. 50, you've got a choice. Right. At 51, go find something else to do. Life is too short.
Right, absolutely.
So she's obviously nowhere close to that 51%, which is fantastic.
And honestly, these are the success stories that, I think she spoke at our HiSET graduation as well. These are the success stories that really we love to tell because it really paints a picture of the work that we do and how quickly we can make a difference in somebody's life.
Awesome. All right, so we've got some people out there who would like to go through one of these programs. How do they get some information? How do they get started? Sure. What do they need to do?
That's a great question. Since we're standing up CCMA really in like 3 weeks, I've been really good about finishing or practicing up my elevator pitch, my 30 seconds. But
let's hear it. The pitch.
The best way, I think, to describe what we do with CCMA is we can get you in an entry-level position in the healthcare field that you can make upwards of $20 an hour with minimal training. It's 21 weeks. It's work you can do. It's training that you can receive when you're not working. It's flexible with the schedule, and it's to the point where you may pay $0 out of pocket, and we were happy to provide that for you. If you have interest in this program or any of the other ones that we do here, my name is Jamie McKim. My direct phone line is 307-772-4256. Call. It's a number that we put on every single postcard, every single advertisement that we have around here. I'm blessed to work at an amazing campus and have these programs available, but I can't reach everybody all the time. So if you hear this or if you know somebody who might have interest in it, give me a call. I'm happy I'm very buggable. I'm happy to have a conversation.
Trust me, I bug him all the time.
And that's what we love about what we do here. But, some of it's just starting, making the call, having the conversation, saying, what can you do for me? Because there's a lot of people who don't think, oh, I can't do that, or I couldn't, not possibly me, I couldn't get free funding. We are starting a class on October 14th, and I don't know when this will air, but we'll do another one next year, and we'll do another one the next year, and we're going to continue to receive grant funding. So if it's an interest that you have, if this reaches you, certainly reach out to me at 307-772-4256. My name is Jamie, and I will answer the phone when you call.
Fantastic. All right, so is there anything related to these programs that we haven't talked about, things you would like people to know about them?
I mean, I think we've covered quite a bit here, James, today, but I think the point that I want to stress to everyone is this is doable work. It's not rocket science. Certainly these are skills that you can achieve or learn to get yourself a better job. And you may be sitting at home right now saying, I wish I had a change in my life or an opportunity. This is that type of opportunity. It's not a magic bullet. It's not going to fix everything, but it can lead you to further things. And I would encourage, no matter what your age is, if you're 20 or if you're 50, explore it. It's something that if you have an interest in it, let's look at it for you and what it could do. And CCMA is a great program. CNA is a great program. Phlebotomy. The healthcare field in general, these are jobs that are not going to go away with AI, with robotics. These are ones that need people who have big hearts and compassion for helping patients. That's what they're looking for, and if that's you or you want to develop those skills, we'll help you get there.
Well, that's a wrap on this episode of Beyond the Classroom. Thanks again for listening. Don't forget to like and subscribe. And until next time, see you later.
I want tomorrow. I want tomorrow. I want tomorrow. I want tomorrow today.